Welcome back to the deep dive, everybody. Today we're looking at something super important for you as eye doctors, which is how age and race can actually have an influence on how quickly myopia progresses in children.
Definitely.
By looking at axial elongation.
You got it.
So axial length, yeah.
Yeah, and we know that understanding this is key to effectively managing, your young patients who are coming in.
For sure. And I think, when we talk about tracking myopia progression, axial elongation, right? So that lengthening of the eye has really become, kind of the measurement of choice.
Oh, absolutely.
But the precision we get with today's optical biometers is amazing.
Yeah.
I mean, it's really remarkable how we can monitor, even subtle changes.
Yeah, exactly. And so our mission today is to really kind of unpack a recent study that looked at this.
Right.
It's a systematic review and meta-regression that just really dives deep into the impact of age and race on axial elongation in kids.
Okay.
Specifically those with mild to moderate myopia.
This was not a small undertaking.
Yeah.
They looked at data from 64 different studies encompassing 83 subpopulations and 142 evaluations with complete information.
That's a lot.
It's a lot. And they even did a follow-up analysis with an even larger pool of data.
Okay.
202 evaluations, and the trends held up.
Oh, wow.
So we're dealing with some pretty robust stuff here.
Absolutely.
That hopefully will be very eye-opening for your practice.
I love that. Got to get the puns in.
You got to get the puns in there.
You got it.
So what would you say is like the central finding?
Yeah, so I think the headline, if you will, is that Asian children experienced a significantly greater mean axial elongation compared to non-Asian children.
So how much greater are we talking?
About 38% greater.
38%?
Yep.
That's a huge difference.
It's a significant, and statistically as well.
Well, yeah, I was going to say, is there like a p-value or a confidence interval around that?
Yeah, so the confidence interval ranged from 19 to 61%.
Okay.
And the p-value was less than 0.01.
Less than 0.01. Okay, so very statistically significant.
Very much so.
Now, is this just like across the board, or is this like, at specific ages? Like, how does...
That's a great question.
How does age play into this?
So that's a really interesting nuance here.
Okay.
While the amount of elongation differs between Asian and non-Asian children, the rate at which that elongation changes with age is similar between the groups.
Interesting.
Both Asian and non-Asian children show about a 15% decline in axial elongation per year as they get older.
Oh, wow.
So
they're both slowing
down as they get older.
Some are starting off at a higher point.
Exactly. It's like they're both on the same, downward slope, but one's starting higher up on the graph.
Makes sense. And I imagine that has implications for...
Oh, for sure.
How we manage these patients.
Absolutely.
I was going to say, is there a confidence interval or p-value for that as well?
Yeah, so the confidence interval for that decline, that 15% decline, was between 12 and 17%. And that p-value was even smaller, less than 0.0001.
Wow.
Highly significant.
So highly significant. Okay, so we've got this like main finding that there's this difference between Asian and non-Asian children.
Right.
But this interesting trend of slowing down with age.
Exactly.
Now, how did they actually tease this out? What kind of analytical lens did they use?
They used a pretty sophisticated statistical approach called a multivariate linear mixed effects meta-regression model.
Okay, so break that down for us.
Yeah, so think of it as a way of, looking at a lot of studies at once. And kind of teasing out the real signal from the noise. Even when the studies themselves are a little bit different from each other.
Right.
The multivariate part just means that they looked at multiple factors at the same time. The linear part assumes a roughly straight line relationship between these factors and axial elongation. And the mixed effects aspect is really important here. Because that accounts for the fact that not all kids or even all studies are the same. It allows for variability between different studies, between different subpopulations within those studies, and even within individual children over time.
So it takes into account that individuals are different.
Exactly. And that's where those 3 levels of random effects come into play.
Gotcha. So it's like having a super smart detective who can look at a bunch of different crime scenes, which were like the individual studies.
I love that.
And find the common thread.
Yeah.
That's a great analogy.
It is.
Yeah.
So before they ran this analysis, they had all these factors, right? They had what we call covariates.
Yep.
These are all the other things the researchers thought might play a role in this.
Yeah. So they were really casting a wide net.
They were.
To see what could be influencing axial elongation.
For sure.
And this initial list included things like the average age of the children in each study at the midpoint of the data collection.
Yep.
The inclusion criteria each study used to select participants. The race code, which is, you know how they categorized ethnicity.
Yeah.
Axial length and refractive error at the start of the study.
Okay.
The percentage of girls in each group the year the study was published.
Wow.
The type of study.
Yeah.
Like, was it a clinical trial or just observing kids over time?
Right.
How they measured axial length.
Yeah.
If they used ultrasound or those precise optical biometers we talked about.
Makes sense.
And even the type of vision correction the children were using.
Wow, that's a long list.
It's a huge list. So was there anything on that list that you were surprised didn't end up being significant?
I think it is really interesting that they considered all those things.
Yeah.
And after they ran the models and kind of eliminated all the factors that didn't really show a significant association, only 2 variables remain.
Okay. Which were?
Age.
Okay.
And that ethnicity code for race.
So those are the 2 big ones.
The 2 big ones.
Interesting. And, you know, I guess I'm wondering, like, if baseline refractive error wasn't significant.
Yeah.
Does that suggest that the initial severity of myopia is less predictive of how quickly it's going to progress?
That's a great question.
And these other 2 factors?
Seems that way, right?
Yeah.
It seems like this study is saying that age and race are the big players here.
The big players.
More so than some other factors.
Right.
And they even took this a step further and came up with a mathematical equation.
Okay. Hit us with it.
All right. So LNRA Delboy 362 Alebra 0.158 mean avellage plus 0.325 eth code.
Okay.
So alpha represents the mean rate of axial change.
Okay.
In millimeters per year.
Okay.
So you can see how age represented by the mean age at evaluation and that ethnicity code directly factor into predicting that rate of change.
Okay, so this is great for the statisticians out there.
Exactly.
But for those of us who aren't, you know, doing logarithms in our head
of course.
In the clinic every day, did they have a more interpretable version of these results?
To make it more accessible, they exponentiated those values from the model.
Okay.
Which essentially turns those logarithmic units into percentages.
Okay.
So for the intercept of the model, the exponentiated value was around 43.61.
Okay.
For mean age at evaluation, it was about negative 14.62%.
Okay.
And for the ethnicity code, it was about 38.40%.
Okay, so that makes it a lot more clear.
Exactly.
And like really directly applicable to what we might be thinking about in practice. Now, I did notice one thing in the study that I wanted to ask you about.
Sure.
They made a distinction between instantaneous axial elongation and annual elongation. Yeah. Can you clarify that for us?
So that's a really important distinction.
Okay.
The alpha in their model represents that instantaneous rate of axial elongation at a specific point in time.
Okay.
It's almost like a speedometer reading at a particular moment.
Gotcha.
But what we usually see reported in studies, and what's most useful for tracking over time in clinic, is the annual elongation.
Right.
So that's the change in axial length over a whole year.
Right.
And they actually mentioned that you can get a good estimate of annual elongation for the subsequent year by just adding 0.5 to the child's age in the model.
So you just plug in their age plus 0.5.
Exactly.
And that gives you a better sense of...
Yeah, it gives you an estimate of what you might see over the next year.
That's really helpful.
It's a way to bridge that gap between what the model is giving you and what you might actually observe in your practice.
Perfect. Yeah, that's a great way to think about it.
Yeah.
Now, they also talk about this figure 2 in the study.
Yes.
I'm guessing that's a visual representation of this.
It is.
What does that show?
So figure 2 plots all the individual data points from those 64 included studies.
Okay, so it's a lot of...
It's a lot.
Data points on one graph.
Exactly. And it shows how axial elongation rates varied across different ages.
Okay.
And both for Asian and non-Asian children.
Okay. Yes.
But the cool part is it also overlays the curves generated by their meta-regression model.
So you can see
exactly, the average trend line.
Trend lines, yeah.
And then it gets even better. It shows the confidence and prediction intervals around those curves.
So you can see.
So you can really see
how much variability there is.
Exactly.
Yeah.
And the size of each data point in the figure actually tells you how much weight that particular study had in the overall analysis. So you can really see the bigger picture.
Yeah.
And how much spread there is in the data.
Okay, so speaking of that spread, they really emphasize the wide prediction intervals.
They did.
What does that tell us about managing myopia in individual kids?
Yeah, so it's important to remember that while we can talk about average trends across large groups, there's a ton of variability in how individual children's eyes grow.
Right.
So these wide prediction intervals in their model, and it's like a 40% decrease to a 60% increase in axial elongation across all ages for both racial groups, really highlights that challenge of predicting and managing myopia in any single child.
So just because we know their age and race, it's like a guarantee. You really need to monitor each patient longitudinally.
Now, the study also had this table 2, which had some examples of estimated cumulative axial elongation.
Can you walk us through some of those?
Sure. So table 2 gives these projections for cumulative axial elongation, which can be really helpful for talking to parents.
Right.
For example, their model projects that an 8-year-old Asian child might experience, on average, 2.38 millimeters of elongation by the time they reach 15 years old, and around 2.83 millimeters by age 18.
Now compare that to
a non-Asian child, same starting age of 8. Their projections are lower, a mean of 1.72 millimeters of elongation by age 15. And 2.05 millimeters by age 18.
So still significant, but not quite as much.
Not quite as much, but remember those wide prediction intervals?
There's that variability.
Exactly, for that 8-year-old Asian child. With a projected mean of 2.38 millimeters. By age 15, some kids in that group could experience more than 4 millimeters of elongation.
So we really got to keep that in mind.
Yeah, individualize.
Now, they also briefly mentioned how their model compares to some of the previous models of axial elongation.
They did.
What are the key points of comparison there?
Yeah, so they highlighted that their meta-regression is the first to use a weighted random effects approach when you're looking at this question across so many studies. And they believe this adds to the robustness and reliability of their findings when they compare their trends to other models such as Jones et al., Wong et al., and Howe et al., as well as more recent data on Chinese children from studies like Hu et al. And Naduvaleth et al., and U.S. children from Muti et al. They found a general agreement.
Because they're all kind of telling the same story.
Yeah, they're all seeing those same trends.
Especially those more recent ones.
Right, especially with the more recent studies.
Focusing on Chinese populations.
Exactly. So this consistency across different research efforts gives us more confidence in the patterns that their model is showing.
That makes sense. I mean, you always feel better when things are corroborated by other studies, right?
Of course. They also raised some really interesting limitations of using percentile growth curves for axial length.
Okay, so why would those not be ideal for tracking myopia?
Yeah, so they had a couple of concerns. First, a lot of the currently available percentile growth curves don't differentiate between children who are myopic and those who aren't. And this is a limitation because the growth patterns of myopic eyes are different.
And they're the ones we're really worried about.
Yeah, we want to know how myopia is progressing. The second concern was that these curves are often based on the underlying prevalence of myopia in the population they were derived from.
So it might not...
So if you're using a curve from one population, it might not be accurate for another population.
That makes sense.
And then thirdly, they pointed out that it can be difficult for a myopic eye to stay at the same percentile over time. Because their growth pattern might diverge from the average.
Makes sense.
And finally, they noted that even within the same community, you can see differences in these curves depending on the age range of the children used to create them.
So while those percentile curves might be helpful, they're not.
Yeah, they're not perfect.
Perfect, yeah.
Especially for tracking myopia progression specifically.
Right. Okay, so how do they suggest that eye doctors can actually use this model and these insights?
Yeah, so they had a few key practical applications.
Okay.
First and foremost, they emphasized the value of axial length as a primary metric for monitoring myopia.
Yeah.
And that's because it's so easily and quickly measurable with our modern instruments.
Especially those optical biometers.
And you often don't even need cycloplegia.
Right.
So it makes it really easy.
Makes it so easy.
And convenient to do frequent assessments.
Right.
They do caution, though, against overemphasizing very short-term changes.
So like
over 3 to 6 months.
3 to 6 months, yeah.
Because those can be influenced by seasonal variations and might not reflect the true progression rate.
So don't overreact to like a little blip on the radar.
Exactly.
Gotcha.
They also really highlight the model's usefulness in assessing how an individual child's myopia is progressing. Relative to average progression. So you can compare them to untreated children of a similar age and race.
So it gives you a benchmark
to
compare against?
It does. And that can be helpful in identifying rapid progressors.
Right.
Those are the kids that might benefit from early intervention with myopia control.
Gotcha.
And then it's also valuable for evaluating how effective those treatments are.
Right. Because if they're not working, then
you might switch to something else.
Right. And so then I guess that leads to the question of what a reasonable treatment goal should be.
Right. So the researchers suggest aiming for axial elongation that's lower than what the model predicts.
So lower than the average?
Lower than the average for untreated children of the same age and race.
So you want to be doing better.
Exactly. Than nature.
Than nature.
And they referenced a study on dual focus contact lenses. Where the average 3-year axial elongation in the control group was 0.62 millimeters.
So that's kind of like
that's a good benchmark to aim for.
That's a benchmark to aim for.
To do better than.
Yeah. All right. Well, this has been a really eye-opening discussion. I hope our listeners aren't feeling too blurry-eyed.
I hope it hasn't been too lengthy of a discussion.
I know we've covered a lot of ground here.
We have, but it's been great.
Now, I know the study also mentioned some factors that they couldn't fully evaluate.
They did.
Because of limitations in the data.
Right.
What were some of those things?
So they pointed out that their analysis was limited by that broad non-Asian categorization.
Right.
Future research would benefit from having more granular data.
So looking at like...
Exactly. So things like African-American, Hispanic children.
Gotcha.
And seeing if there are distinct patterns within those groups as well.
And I know you've talked to a lot of experts on the show, and I'm wondering, is there any sense that there might be differences there?
I think there's definitely a sense that there are.
Yeah.
But we need more data.
We need more data to really tease that out.
Absolutely.
What else did they say?
They also talked about how parental myopia might have an influence.
Okay.
Some studies suggest that there might be faster progression.
So if the
parents are myopic.
Are myopic, the kids?
The kids might progress faster. And then there's the question of gender.
Oh, right.
Some evidence suggests that there might be slightly faster elongation in females.
Interesting.
And then there's also the impact of environmental factors like rural versus urban living.
Oh, wow.
So there's still so much more to learn.
Yeah, there's so much more to learn.
It's really fascinating.
Didn't they also reiterate one of the main limitations?
One of the main limitations of doing a meta-analysis like this is that you're relying on data from already published studies.
Right. You don't
have individual patient data.
Access to that individual level data.
Exactly.
So it makes it harder to tease out these effects.
It does.
And I imagine that's one of the reasons why they couldn't look at those hypermyopes.
Exactly. They had to exclude studies that only focused on children with high myopia.
Which is, anything worse.
Worse than -6 diopters.
-6 diopters. Okay.
So future studies that do have that individual patient-level data will be really helpful.
All right. So for those listening who want to maybe delve deeper into this research themselves, how can they access this study?
A link to this study is in the deep dive description.
Perfect.
If you're finding this information valuable for your practice, please consider following the podcast and leaving us a 5-star rating.
We really appreciate your support, and I hope this deep dive has been helpful.
I do too. Yeah.
So just to kind of like wrap things up, what are the key takeaways for our listeners?
I think the main points to remember are that on average, Asian children tend to show faster axial elongation compared to their non-Asian peers.
Okay.
But in both groups, the rate of elongation slows down as children get older.
Oh, okay.
And even though we can talk about these general trends, there's that significant individual variability in how quickly a child's eye will actually elongate.
So we have to take that into account.
Absolutely.
Now, this model and the findings from the study give us a really valuable framework for monitoring myopia progression and for evaluating how well our treatments are working.
Exactly. By understanding these average trends and how age and race play a role, and by comparing a child's progression to these benchmarks, we can make better decisions about when to intervene and how to best manage their myopia.
So as a final thought for y'all, as you go back to your clinics today, given all this variability, how can you best personalize myopia management strategies beyond just thinking about age and race?
That's a big question.
It is a big question.
And a very important one.
And I guess the other question is, you know, what are some promising areas for future research that could help us kind of refine that understanding even further?
Absolutely.
And maybe allow us to create even more tailored treatment plans.
That's what we need.
So this is definitely a valuable piece of the puzzle.
It is.
But there's still much to learn.
Definitely.
We encourage you to check out the study. Absolutely linked in the description. And continue your own deep dives into this fascinating and important area of eye care.
Absolutely.
Thanks for joining us today on the deep dive.
Thanks, everyone.